Good afternoon. Thank you very much for attending today. Want to welcome you all to today's Lunch and Learn, which is called Show Me the Money, Vaccine Reimbursements for Local Public Health Departments. This program today is presented in partnership with the Massachusetts Association of Public Health Nurses. And our moderator today will be Gail Johnson, who is the president of this organization. A few housekeeping measures before we start. All CEUs, a completed evaluation is required for CEUs. RNCUs will be issued by the Massachusetts Association of Public Health Nurses. Then email with instructions and evaluation link will be sent after this webinar. Any questions that you have today, please use the Q&A, not the chat function. We will answer all the questions as best we can, as quickly as we can. We will provide any written responses to any unanswered questions we don't get to, and those will be sent out after the webinar. Today's webinar is being recorded. Presentation slides and the recording of today's Lunch and Learn will be posted on the MHOA's website in just a few days. I would like to now introduce Gail Johnson, who's our public health nurse and president of MHPHN. Thank you.
Thank you, Ray. I appreciate it, and welcome to everybody. I'm excited to be moderating this webinar today. We have so much to cover that I don't really want to take too much time away from our lovely Brittany Rahall. She is from what used to be Commonwealth Medicine, is now ForHealth Consulting. And I'm going to let you take it away, and I'll be monitoring the Q&A and try to answer. But I would really appreciate if everyone can just kind of hold off their questions until the end, so that hopefully maybe your questions will be answered throughout this webinar. And then we will try our best to, answer as many as we can. And then if we are not able to answer, we will reach out to you individually. Take it away, Brittany.
Thank you, Gail. Thanks everyone for being here and joining today. And, thank you to MHOA and MEPHN for the opportunity to speak to our program and provide additional information to continue supporting this important public health work that's being conducted across the state. A few other housekeeping items, as Gail and Ray said, both the slides and video recording will be available following the webinar. We have a few videos during the presentation as well, and we have a guide that includes screenshots of those videos that can also be provided for anyone, in the links to these videos to watch again in the future. Thanks to Ariane Henry from the DPH Color team for creating those. She will also be here during Q&A to assist if there are color specific questions that come up. And as Gail mentioned, please keep the questions to the Q&A. We do have a lot to get through. Hopefully I answer them during the presentation. And in the interest of time, if you have town specific questions, that are very specific to your community or your claims, we do ask that you email vaccine@umassmed.edu. That's also at the contact information on the end of the slides, so that we can address those for your community directly. And so we do have a lot to cover on our program. It would be impossible to cover it all in an hour. So we want to encourage everyone to attend one of our trainings. We host these annually each August to learn about the nuances of our program more in depth, and to go over some of the things that aren't covered here today. With that, our agenda, I'll give you a quick introduction to ForHealth Consulting, our new name, some program background and overview. Then the meat of the presentation will go over the vaccine reimbursement process and timeline of our program, as well as tips and best practices in color, along with a couple of video how-tos of how to do these best practices while you're using color. Then we'll go into a bit of a reporting overview of the reports that our program has available for use, and then how to contract with us, as well as an FAQ, and then open it up to everyone for anything we might have missed in a Q&A. So with that being said, as Gail mentioned, we were formerly Commonwealth Medicine with UMass Chan Medical School. We've rebranded to ForHealth Consulting. At ForHealth Consulting, we partner with purposeful organizations like yours to improve the healthcare experience and make it more equitable, effective, and accessible. So we leverage our world-class expertise with the medical school and deep experience to create transformational solutions across health and human service spectrum. We always aim for better access, better knowledge, and better performance across the healthcare spectrum, and are always working towards what we're here for health for all. And so that was really part of our name change. We are still a part of UMass. We weren't, bought out or changed to a different company. We just truly rebranded to a name that we felt better fit the mission of the work that we're performing. Background on our vaccine reimbursement program. ForHealth Consulting and the Massachusetts Department of Public Health partnered to create a streamlined process during the H1N1 pandemic to allow providers hosting public clinics to receive reimbursement and financial support. Our main program goals include helping providers serve individuals of all ages in their communities and removing any potential barriers to vaccinations. The goal of our program specifically, and the ideology behind it, is to centralize resources for contracting and claiming services so that our decentralized public health model in the state can leverage economies of scale and benefit local public providers, so that each city and town isn't out performing this work separately, procuring the systems and the contracts and the workforce needed to conduct these services. Along that model, we also aim to operate on an annual basis to maintain readiness in the event of a public health emergency. Specifically, as we all just saw with COVID, and as with everyone involved, I do just want to touch a little bit on that COVID rollout one last time for anyone that came to our trainings again in this past year. So as with everyone involved in the public health sphere, this last goal of operating on an annual basis to stay ready became glaringly apparent during the COVID pandemic and rollout. We just want to acknowledge, as we have that the insurmountable task we were all, collectively tasked with over the last few years. The work that you all performed on the front lines and the work that our small but mighty team took on the back end. Our technology was not prepared, to handle the volume and pace with which we scaled from 75,000 claims a year to 2.5 million in a small window of time. So we do just again want to acknowledge that there were claims from 2021 and 2022 that were potentially negatively impacted as we worked to scale this program and our resources. And while we worked with DPH to transition from a paper-based model prior to COVID to the various electronic vaccine delivery platforms in real time. However, we do just want to say we've closely monitored our updated processes, that were put in place over last summer into this fall to now, and we can see in real time that our efforts to improve our systems, our technology, and our workflow are paying off. So I'll go into that process and the reporting available during this presentation. And we do hope, that anyone who's experienced frustration with our program over the past year can use these reports and tools to review your payments from this fall and this past flu season to see the work we've done to address these issues and your concerns. So we are just emphasizing that we're well equipped moving forward to handle the commercialization of COVID vaccines, which I understand is a part of, wanting this presentation to think about into the fall. And while we hope another pandemic is far down the horizon, we are, much better prepared to meet that goal should it occur again. Over the course of time, we've continued to evolve our program. When we first started, this was just for H1N1 vaccines. We've expanded across all of the major health plans, including Medicaid. We've added in being able to bill for the addition of other ACIP recommended vaccines for both adults and children. Worked with all of the ACO plans during that restructure. And then most recently, the addition of COVID vaccine and introduction of our electronic program model. So the covered services that we are able to bill for, and again, we do go more into the nuances of this in our training. So at a high level, we can bill the health plans for immunization administration to all individuals. And this includes all ACIP recommended adult and pediatric vaccines, as well as the COVID vaccine. So when we say Immunization administration, this refers to the time that the nurses are spending administering a vaccine into, a patient's arm and that process. There's also the immunization cost component that we're able to bill when an individual is 19 or over, and the community has privately purchased those vaccines for adults. So this chart details that a little more specifically. We aren't able to bill for the cost of state supplied vaccines, only the administration fee, because you all receive those for free from the state. And for COVID right now, this chart currently indicates that we can bill for the administration, but not the vaccine cost. We fully anticipate once COVID is commercialized and available for health departments to purchase, that we will be able to bill for COVID the same as any other flu, or Medicare B covered vaccine. Our participating health plans are listed here. I do just want to point out Mass General Brigham Plan was formerly known as Always Health Plan. If anyone sees or feels that that's missing, it's just rebranded as well. And we do want to point out that we will also submit claims to Mass Health and Medicare Part B, but that as a community, you must enroll with those payers directly as a provider for us to be able to submit claims to them on your behalf. And then with a few of the other plans, such as Anthem and out-of-state Blue Cross plans, we don't have a direct contract with those plans, but we will submit claims to them as an out-of-network provider. We do see many of these pay, but reimbursement will vary. There are, many out-of-state plans that won't cover a vaccine administered in a Massachusetts clinic. And with United, we will also submit all claims to United as an out-of-network provider, but as it is a national plan and they're not directly contracted with us, the reimbursement there will vary as well. So reimbursement rates, I'm going to talk initially about non-COVID vaccines. A few things to point out. A question we're always asked is, is there a chart or an exact, handout of rates? So we do want to address that here. So our program is a model unique to Massachusetts based on centralizing resources, as we talked about. Our health plan contracts are therefore atypical. It's not, standard that a health plan would contract with a third party. They're used to contracting directly with providers. And it's driven by all of our providers being enrolled in the DPH immunization program. So the health plans are requiring that all providers are enrolled in the DPH immunization program, and subsequently providers can then are eligible for the state contracting for influenza vaccine pricing. So we encourage you to use the state contract or CDC purchase pricing whenever purchasing vaccines and speaking with your vaccine manufacturers to be sure you're getting the best rate, because that is what flu rates are negotiated at with the health plans. And then in general, and for other vaccines, health plan rates for all services are variable and change annually or quarterly, depending on the plan. So the Medicare reimbursement rate is set at 95% of the average wholesale price of these vaccines. And then the health plans can apply their own payment methodologies, where the rates may vary for their commercial lines, their Medicaid subsidized lines, and their Medicare Advantage products. So this all basically says that it's a very complicated methodology that goes into rates, and it's not static because they may change quarterly. And often the quarter falls in the middle of flu season, for example. The rates will change in October. So September vaccines have one rate, October, November vaccines may have another with certain plans. So as a general rule of thumb, we say that the vaccine administration reimbursement rate will range from $11 to $25, depending on the plan or plan type. Generally speaking, Medicare and Medicare sponsored or Medicare Advantage plans are at the higher end of that. Mass Health and Medicaid sponsored plans are at the lower side of that, and commercials tend to fall in the middle. The vaccine cost itself, so that was for administration. The vaccine cost itself will vary based on time of year and the factors above. At each fall, we do update our range of rates for each vaccine based on these factors, and we're always happy to provide you a range. We get a question a lot of like high dose or Shingrix. Like if you have a question on a specific vaccine, we are happy to provide the range of that vaccine for you. And we also go into this a little bit more at our trainings in August in a little more detail. Vaccine reimbursement rates for COVID. So COVID vaccine reimbursement has simplified over time. In the beginning, it varied by health plan, vaccine type, and the dose that was administered. Currently, vaccine reimbursement only varies by plan type. So Medicare and most commercial plans reimburse at $40 per dose administered, regardless, first, second booster, all the different boosters. Mass Health and some commercial plans reimburse at $45.87 per dose. So these rates are likely to change once COVID vaccines are commercialized this fall. We are already getting the question of, how much will they cost? We aren't, privy yet to that information. I know that in their, investor calls, the manufacturers are indicating it will be much higher than the federal government was able to purchase these vaccines at, closer to $100 to $130. So I would anticipate, the rate for these to go up significantly in the fall and the cost. Going into our vaccine reimbursement process and timeline. So at a high level, our vaccine reimbursement process involves providers submitting insurance information to Commonwealth Medicine. So there are 3 methods. We're really going to focus on color right now in this training, and we do want to emphasize that color is the most efficient way to submit data to our program. But we also offer an electronic roster and an e-fax option in rare instances for submission. So with the color process, we want to point out that color supplies us an automated feed from color to Commonwealth Medicine. This occurs in monthly batches, and they send us this data 7 days after the close of the month. So I think there's been questions on whether it's real time, the way the MIS is, where you vaccinate someone and that information is basically going right off to the MIS. But for billing, you do have some time before the data is sent to ForHealth, and that was done intentionally so to allow time for providers to make updates, whether you needed to update the vaccine information or the insurance information, you wanted to go locate information after the fact. We allow for up to 7 days after the close of the month. So it's important to be mindful of that time frame when you're conducting your clinics, so that you do have a little bit of time to go back, but that at the 7th of the following month, we will receive that data. Whatever is in color at that moment in time is what comes over to our program. So once we receive that data, we then have time to perform an eligibility check and submit those claims. So this is important to our process and central to our process to be sure that we're submitting clean information. We take the time to do that eligibility check to try and work as many errors up front and minimize the amount of time spent going back and forth with the health plans on a denied claim. So per health plan contracts, we have anywhere from 90 days to 1 year to perform that claim submission from this date of service. So our goal when we receive a file, is to receive that data and submit the clean data that passes our eligibility check as soon as possible. We don't hold that, for 180 days. We're submitting it off, as soon as we receive it, it passes eligibility verification and it goes off to the health plans. But anything outside of that falls into a different queue. So we'll talk about our internal process in a couple more slides. After we submit the claims, we send them to the health plans, who then have up to 90 days to pay our program. So that's another 3 months. So, we're looking at a month for color to send the data to us, a few months, either 1 or to 6 months for us to perform eligibility checks and clear up that data and submit it to the health plans, and then up to 3 months for the health plans to pay us. So the goal is obviously, for all of this to happen as fast as possible. And we do see a lot of claims go through this process on the faster side of things, but we're including here, sort of the longest possible window of time, just so that everyone's aware. Then when we receive those payments back, we reconcile and distribute it back to the providers, less a 10% administrative fee for paid claims only. So we just want to emphasize your communities are never charged for a claim that we aren't able to receive payment for. So if it's denied or pended for any reason, we would never charge our fee on that claim. For payment methods, where there are 3 different ways in which you could receive payments for your vaccine services. The first, for commercial health plans that we bill on behalf of your communities, you will receive a quarterly payment in March, June, September, and December that is distributed via a paper check from ForHealth. The notification is then sent in from our program. It includes a summary report that we'll talk about and the amount and the date of that payment. Then for providers that are actively enrolled with Medicare or Mass Health, we issue those payers issue payments throughout the year whenever we're claiming. So typically on a monthly basis, you'd be receiving a payment from Medicare and Mass Health if you're enrolled with those payers and you have administered vaccines to any patients with those health plans. Both of those agencies will pay your community directly via whatever method you provided during enrollment, which is typically EFT. We then send an automated email notification. We're notified that your community was paid, and we send that from notify@quickbase.com automatically to your community. And then at the next payment distribution, we deduct our fee for any Mass Health and Medicare claims that you've been paid for in the prior quarter from our next distribution. So we will go through a payment summary report that kind of walks through that layout a little bit in a moment. So just to go back to the timeline in a little bit more detail. So we did discuss that Color sends us the feed 7 days after the close of each month. We then take each month of data, process it. So to go into that process a little bit more, claims that match the data requirements for the health plans, which typically include the length of the member ID, the name and date of birth match, those are transmitted directly to the health plans. Any claims that fail this match go into a manual queue to be further researched, which is, a much longer process than just sending it off when it first passes eligibility verification. So this volume does vary by time of year. If we correct information and we then submit the claim. If we can't find that corrected piece of information, the claim is ineligible for processing. And as a frame of reference, this past fall, so September through December for flu season, 50,000 vaccines fell into this manual category. And this represents, 44% of all vaccines administered for the same time period. So the longest part of our process is this manual research queue. And that's why when we go into some tips and best practices, when we are always asked, why does this process take so long, or how can I ensure the highest level of reimbursement? Data quality ultimately is the #1 driver of this process. So if there's anything that can be done to ensure the quality of the data that patients are providing when they register in Color, that will pay off for your community, both in speed and in your quality of reimbursement that you receive back. So we'll go into some tips for that in a little bit. Some plans may then reject or deny claims for incorrect data. So some plans will validate everything up front, including the name. Other plans accept the claim in initially and then deny it after the fact if they realize that the junior is missing from the last name, for example, or the date of birth is incorrect for the member. So these claims would then fall back into our manual work queue and get worked in order of our timely filing deadlines with the health plans. Health plans, as we mentioned before, then have 90 days to remit payment. And then we just want to point out that we receive large bulk payment files from the health plan. So they're not sending us a separate check for each community that's, nice and clean and ready to be paid out. We then have to take in those large files, post and reconcile them in our system down to the appropriate communities. So that process also takes some time and is why we issue quarterly payments instead of, doing this weekly or something for cities and towns. And then some smaller plans lastly send paper remittances that then have to be, receipted by UMass and enter into our system manually on behalf of cities and towns. All of that being said, as a rule of thumb, providers can generally expect to receive payments beginning the quarter after vaccines were administered. So I understand, as we talked about earlier in the height of COVID, that these rules that we're laying out here sort of varied, and there was a much longer time frame depending on if we were going through appeals, et cetera. But what we're talking about, from this fall forward with, our newer workflow and our decreased volume that we're working through, you can expect to receive payments starting the quarter after. So for example, while some payments for your September or October clinics might have come in this December distribution, the majority likely came in your March payment that you received. And the remainder of those, some of those research queue claims that we have to work through will come in June. So our goal is that the bulk of your payment is received by that June end of the fiscal year deadline. However, we want to point out that payments can always continue to trickle in up to 1 year after the service date, depending on where the claim fell in that manual queue, if it needed to be resubmitted, one or multiple times. So again, that timeline is largely driven by data quality and whether claims can be submitted automatically or if they come into a different bucket here on our end. So for tips and best practices in color. We do recommend, to ensure your maximum reimbursement and quicker turnaround on claims, to perform an in-clinic check-in and verify insurance information. So I want to say up front that we understand this, may vary, the feasibility of this may vary depending on your clinic. I know having, hundreds of people potentially at your clinic in front of you may make the degree to which you do a check-in possible or not. But that just is the best practice that from a data quality perspective that we would recommend. If you can come up with a workflow that supports that, to do that. You can ask the patient to provide their insurance card and verify that the name and member ID match what was captured in color. Ask patients, specifically seniors, if they have multiple insurances, and capture both in color, because that's the other variable, is that some people may have, multiple insurances and only supplied one. We might then submit the claim, it denies, and then we have to go seek that secondary information. If it's provided up front, we can potentially expedite that process. And if it's not feasible doing this for all patients, you can consider reviewing insurance in advance of clinics and coming up with a workflow where you might identify patients that didn't complete any insurance information and just double check with them, or where the information looks incomplete. And if you're making a decision whether or not you want to try to incorporate this into your clinics, you can pull your past clinic data from a color dashboard to determine the volume of patients in your community that didn't provide information or provided partial or incomplete information, and decide, whether you want to do that. So the next few slides have some quick videos that I'll show you on how to do that. And then I did ask Westford if, we could use this example. We did look at this process with Westford, for example, to see if it's worth it for them to perform check-in at their clinic. So we found, there were around 30 patients that didn't provide any insurance at their clinics, which is pretty good. I know Gail wants to collect it, but that's a pretty good rate. And then we found there were 170 patients that we needed to go back and perform further research on. So for Westford, going after those additional 200 patients to expedite their process and up their reimbursement feels worth it. So they might go look at a workflow that supports that. Depending on your community, you might not feel that volume supports adding this step in. So we just want to emphasize this is a best practice for people looking to expedite the speed and amount of their reimbursements, but is, not mandatory. You can choose to take as much or as little of this, as you'd like. With that being said, I'll show you a quick video on verifying patient insurance information at check-in.
To verify insurance information at check-in.
Brittany, there's no sound.
I think if you unmute Brittany, we'll be able to hear the sound.
Thank you. Let's try that again.
To verify insurance information at check-in, simply go to your vaccination pool, and to the right of your patient on these 3 vertical dots, select Edit Patient Details and select Health Insurance. In this instance, you can see this patient said no to having health insurance. If that is incorrect at check-in, simply change it to yes, I have insurance, and select the insurance information From there, and select continue. That is how you can update and verify your patient's insurance information at check-in.
And following that video, we also have a video on reviewing patient health insurance information, both pre and post clinic.
Color provides you dashboards so that you can check patient health insurance information prior to and post any clinic. So let's check out the pre-clinic process. By going to your appointments dashboard, you can see the information that patients have completed. So they have self-reported using your pre-registration link and the online registration process. If you scroll all the way over to the right, you can see what health insurance information they have self-reported. Many here have reported no insurance, whereas some have reported insurance, but perhaps it's half complete or incorrect. What you can do is you can go to these three vertical dots and you can select download data, and you can download this information into an Excel spreadsheet. You can highlight which patients you want your check-in staff to make sure to double check and verify at check-in. Now let's talk about what you can do post-clinic. So after you've completed vaccinations, you can go to your vaccinations dashboard. Here in your vaccinations dashboard, you'll see that there is a date of service or a date that the dose was provided. So you will also see that same information, and presumably your check-in staff has already updated or verified any of the information that is now on record and reported to the MIS. And if you scroll to the right, you can see what information is on record for the billing file. So again, we see several here that have no insurance on record, or perhaps they have insurance, but maybe it's not fully complete or it's incorrect. What I can do post-clinic is I can go back into that clinic, but first I may want to contact my patient either through phone or email to collect any information that I think might be incorrect or missing. So now I have contacted my patient and I'm going to go back in to update the insurance information in the clinic in that vaccination tool. Now remember, this is after the clinic has taken place. So I go to this filter completed. This patient has already had their vaccination recorded, but I can go into these three vertical dots. I can select edit patient details, and then I can select health insurance. Here, I can add, change, update any information that I need to on that patient's health insurance. There is also time built into the process so that admins can check and double check this information pre-clinic, during clinic at check-in, and post-clinic, all before that billing file gets sent to ForHealth, so that you can ensure that your patient's health information is complete, updated, and correct. Thank you for using color.
Great. So again, that walks you through the process of reviewing and updating insurance information in color. We also have a guide that screenshots each step of this process as well. But we really recommend that you take a look at your clinic data to get a sense of the quality, going into next flu season or additional COVID changes, to see if that extra step is worthwhile in your community of check-in and verification in clinic. The other tool that you can use both to analyze the quality of your reimbursement and for reconciliation and, financial reported purposes are our reports. So I'm going to go into some of the reports that we offer now. So the standard report that everyone receives with their quarterly payment distribution is a payment summary report. So you receive this in an email from us each time that a payment goes out. A few things that I want to walk through on this report. So the date range that's listed at the top, and I know this is a little small, but September through December 19th represents the dates when payments were received and reconciled by ForHealth, not when vaccines were administered. So we get that question a lot. Timing wise, we like to include when we've received and reconciled. The title at the top of the report includes which quarter's payment that is. So this is the December disbursement report for payments from September to December that ForHealth received on your behalf. It's broken down currently into COVID and non-COVID services for anyone working with FEMA or MEMA that needs to call that out separately at a high level. And it does display any payments that were also directly received. So the top portion shows the commercial payments that UMass received on your behalf. The next portion, if you participate in Mass Health or Medicare billing, will show any payments that you received directly, and therefore the corresponding 10% that we're deducting of those payments from your commercial plan payments. And then we do that again for COVID. So your commercial COVID vaccine payments that came in, and then any direct payments you received from Mass Health or Medicare in the prior quarter, with a total of what was actually payable to your community. So we do display this, and then we show the payer, if it's a commercial plan or Mass Health and Medicare, and the number of services administered. So another nuance that we just want to point out, a question that we get a lot, if there's like more vaccines administered than you're receiving payment for or something, some plans count services as one per patient. Others count it as two. So one for the vaccine administration and one service for the vaccine cost if it was a privately purchased vaccine. So unfortunately, we can't control the way the payers send that information back and can't, roll it up in a one-to-one. But that is why you might see some variation in the number of services and in the number of patients that you vaccinated. So we also have ad hoc reporting that can be requested. So we offer a patient detail report, and we can offer this after each quarterly distribution. It contains all of the PHI or patient level information that corresponds to that payment, including service date, vaccine, the patient. We put this in our payment emails, but please, respond to us and request those directly. We have many towns, that don't want this level of detail and many that do. So we do offer that on a by request basis. The same is true for Mass Health or Medicare patient detail reports. So anytime you receive a payment notification from Mass Health or Medicare, we can also supply your community with the detail level reporting on that payment as well. And we do all of these requests through our SFTP or secure file transfer protocol site. So we would get you set up on there so that we can send you this patient information securely. The next two reports are useful for, sort of a retrospective look at your flu season or a specific period of time. So we offer a denial report. We offer this after our June or September payment distributions. We'll talk about that in a minute, and it summarizes claims that are currently denied. So we want to point out that these may still be worked by ForHealth and paid later, or claims that were denied. And claims might appear that were denied, but later billed to a different health plan. So that's why we offer these a little bit later in the year. If we sent this to everyone after March, there would be many claims listed on there that we're currently working that will resolve themselves before the next payment distribution. The same with a claims pending report. This also summarizes claims that are submitted to the health plans but not yet paid or denied. And again, we offer those after the June or September distributions. Providers, you can then use these reports to reconcile patients in color to payments received from our program. So we understand currently, this is something that would need to be done outside of color. If your town is reconciling at a detail level, DPH, is exploring ways to streamline this process with color. If there would be a potential way to reconcile in product, which would be great. But for now, you can take our detail and marry it with the dashboard data from color if you're looking to reconcile at a patient or vaccine level. The contracting process for our program, to enroll, all providers must attend a vaccine reimbursement training held each August. So if you work with our program, you're automatically on our contact list. You'll get that information on signing up in the next month or two. And we also offer trainings available on request. If you onboard with us outside of that time period, we're happy to send you the materials and set up something to walk you through our process directly. Gail?
Can I just interrupt? It's 12:40 and we don't have, we wanted to open it up to questions. And I know you have a few slides because I preview them, so, but I wanted to bring in Ariane Henry, yes, to also answer some questions. So we do want to open them up to questions, but I will let you quickly, I know you're talking as fast as you can, but we have a small little time limit.
We'll speed it up. And I just want to point out that the last slides are FAQs. So I think if I can get to those, it might clear up questions that people have that are waiting. So then just to wrap up contracting quickly, you'd need to complete a contract and maintain your enrollment in the DPH immunization program and provide us a W-9 so that we can pay you all for your services. Helpful contacts, you'll have these slides after for our program, as well as color with the color team with DPH and color directly. So FAQ, and then we'll go into the any other general questions. Something we're constantly asked is, why did ForHealth not pay a claim? So I just want to be sure this is understood. We don't pay vaccine claims. ForHealth acts as a third-party biller to submit the data collected at your clinics to third-party payers. So generally, claims are denied by health plans due to demographic information submitted on the claim not matching the patient's information on file, or because the patient has a limited or non-participating health plan. So we aren't able, I wish we could pay you all for every vaccine you administer, but we aren't able in sitting here, with the money and paying that out. We're billing third parties for those claims. Why does the process take so long? So I won't go, we really went into that a lot in the presentation, but it's all of that, those steps that we outlined earlier for the work that we're performing. Why don't we provide a denial report with every payment? So we work vaccine claims year round. Most vaccines are administered in September to December. So we then review denied claims to determine whether they can be worked and corrected. This process takes time, and a claim that we supplied on a denial report in March would likely be worked and resolved before June. And we find that denial reports in June are a much more accurate depiction of your denials than anything earlier in the year. We touched on why there might be a discrepancy between the number of vaccines administered and the number of services on reports for the year. It could be one claim per patient or multiple claims per patient if it was privately purchased. Why doesn't the date range on the payment summary report reflect when vaccines were administered? So that whole workflow that we talked about shows why you might receive a payment for vaccines administered across a wide service date range. So the date range on our report is when we receive and reconcile payments. If you get that patient level detail from us, you're able to see the exact service date makeup that is made up in your payment. Why don't we email or supply these detailed reports automatically with each payment? So we pride ourselves on our commitment to patient privacy and data security. Many communities, in fact, the majority of communities that we work with, do not review or request the patient level detail back. So sending this level of detail out to everyone would involve unnecessarily sending a large volume of PHI. For the same reason, we don't email it to you directly, and we set you up if you want this information on our SFTP site, which lets us securely transfer the data to you all. Are there mechanisms besides color that can be used to submit data? So again, just want to emphasize color is by far the most efficient mechanism to submit data to our program, but you may also use an electronic roster or in rare instances securely e-fax data to us, and our trainings go over these processes in detail. And then lastly, are you required to work with ForHealth to receive vaccine reimbursement? So, we strive to be a reliable and advantageous resource to your communities, but you are by no means required to utilize our program. You can choose to credential, contract with health plans directly, and procure billing systems and staffing to conduct these services independently, should you choose. So sorry, Gail, for running over, but I'm happy. Please flag any additional questions and we can open it up to a Q&A.
So a couple of people have, first of all, before I even say anything, I want to thank you so much, Brittany. That was a lot of information. And, we're hoping maybe if we don't get to answer everyone's question, it would be interesting if you would put into the question and answer section if you're interested in another webinar or an in-person thing. I don't know if that is something that you could do, but really, if we can't answer all the questions or you have we're going to try the best we can, but just so you know, we would be willing to do this again. And Ariane Henry is here from Color. She is also here to help with the Q&A. And I also thank you, Ariane, for being here and for also already answering some of these questions. So I'm going to start by reading some of the questions and we'll go with there. So if only one insurance card is provided out of multiple, what happens to reimbursement at that time?
Sure, great question. So if you're in clinic and someone only, supplied one, but you suspect they have additional, we do recommend that you ask them for that information and try to add it in the secondary insurance information fields in Color. If a claim gets to us with only one piece of insurance information, it gets denied by that plan and it turns out the patient has a different health insurance. So the answer there varies on the insurance that they have, believe it or not. Some plans we're able to, specifically with typically commercial plans, we're able to look up and locate that information. We would then resubmit the claim to the appropriate health plan. If the patient had Medicare and didn't supply that information, Medicare is very strict with what we're able to locate. So we can't look up a Medicare beneficiary without that Medicare beneficiary identifier. So in that case, that claim would be, a true denial on our end where there's nothing further we can do to work that claim.
Thank you. Another person wrote in, while it would be nice not to have to re-enter insurance information, the best practice in any traditional medical setting is that insurance card and IDs are provided each time of a visit as changes can occur. It also verifies and protects patient identity, which I agree with.
Yeah, I think that's a great point. A couple pieces there. So one is that Color, doesn't store the cards for insurance, and also Color is based on a clinic workflow. So patients at clinics might be going to one community for a vaccine at one point and a different community, at a different point, in which case you'd be then sharing that patient's information with different providers. So I'm not sure that is something that Color can done from a privacy perspective. But I don't know, Ariane, if you have any ideas on future ways Color could.
Thank you, Brittany. That's exactly right. And I did put in the chat that Color is not an EHR, and so it does not retain patient information. And really that's specifically because of privacy and HIPAA reasons, as well as that it is functioning as a vaccine clinic management software versus as an EHR.
Thanks, Ariane.
Me, I don't see anybody else asking any other questions. I'm thinking someone must have a question. We've got two experts here that could help answer. And so I just want to make sure, if a patient has Medicare Advantage plan, they retain their Medicare card. Should both numbers be entered into color? Does it matter which is identified as the primary payer?
This
And
is a great question. And, you know, there's the surface answer and the safe answer. So the surface answer, if the patient feels that they know their primary insurance, you know, you can go ahead and enter what they're saying, you know, is the primary insurance, and just send us the Medicare Advantage plan, which in the scenario you outlined would typically be the primary payer for most vaccines. But there is also the chance and variability with a commercial plan that they might have fallen off that plan, and Medicare in that case would be primary. So we would recommend that you send the Medicare information as the secondary as well. So if it is denied, we can then follow up on that claim.
all right, did that requirement change? Someone asked.
For
I'm not sure. They weren't, that was all they said. Did that require, and maybe the same person, but I'm not sure what that was referencing. Someone else wrote, if someone only has their secondary insurance and not their Medicare card, will the secondary pay?
Unfortunately, no, that would be denied. And that's such a good example of if that came through to us with just secondary information and no Medicare information, we are unlikely to be able to obtain reimbursement for your community for that patient, because Medicare is so strict with that ability to check eligibility without the member ID.
Is it possible to submit claims if the date of service was months in advance?
So no, typically no. If it's 7 days after the close of the month, we wouldn't receive that information regularly from Color. We do make exception, you know, we want to be here as a resource. So if you forgot to, you conducted a whole clinic outside of Color, or something arose, you had technology issues, like, you know, we're always willing to work with your community, but, you know, we can't guarantee that we would be able to get the claims in within that time frame that we're obligated to with the health plan. So that's the other piece, is that we have timely filing contracts with the health plans, which range from 90 days to a year for Medicare.
Another person wrote, with insurance cards, we are vexed by transcribing 1 versus 1. I think that's what it means, or 0 versus 0. I hope you know what I'm talking about. For example, is there a problem on your end?
So it can,
problem on your end.
it can be, we have in that whole eligibility process, we have some robust rules and things that we look for. So like with Medicare, for example, certain numbers and digits aren't valid. And we set up rules to try and help with that process. If, you know, an I, which actually can't be a letter in an MBI from Medicare, if an I is listed, convert it to a 1, like for that purpose. But again, those are rules that we hope capture, you know, as much as possible, but aren't steadfast. So obviously, if you can QC them to the best of your ability, that helps. But we do try to account for those kinds of transposed digits, or difficult to determine digits.
Another person, can you go over updating family insurance? Same insurance card for several family members.
Yeah, that's a great question. So actually we, Color is currently developing a group or family registration process where you don't have to re-enter that information for each individual. That will be available most likely by September 1 in product. So that will be a huge and helpful update.
That's a great feature.
Will you have another webinar closer to flu clinic season, August to September?
Yes, we will definitely have multiple trainings in August, and we'll make a recording available as well.
And how much planning time is typically required for a vaccine program to begin using Color?
That's a great question. Yeah, I think it would depend on a few factors, like if you already have an MIS PIN, but generally the application process is really quick. I'd say at max about 15 minutes online, and then you in about 2 to at most 5 business days, your color account is live, but reach out to us at colorhelp@mass.gov and we can help with getting you set up.
And then from working with our program, our contracting process is very quick and simple. If you are looking to enroll as a Mass Health or Medicare provider to bill those plans, we do recommend that you plan for about 3 months or more, depending on the quality of data you supply during the enrollment and credentialing process with Mass Health and Medicare. So now is a great time to get started if you want to enroll in advance of flu season for those payers. And you can also email our program for assistance with enrollment with those 2 health plans.
With the time running close to the end, there are so many questions I'm seeing now in the queue. I think what we should do with that is, and luckily we're able to grab these Q&A questions and we can answer them after the webinar. We'll send that to you both and try to answer it. I hate to make sure, I just want to make sure everyone gets their questions answered, but we're running out of time to do that. I just want to do a quick, unless you have anything else to add.
I do see I think the person clarified the follow-up question of like, did that requirement change? So I will just try to get to that one since it was from earlier. So ForHealth is not required if using color anymore. Did that requirement change? So that has always been the case, that a provider can choose to use color and conduct billing services on their own. That didn't change.
All right. For anyone who else has questions, again, you can always reach out to Brittany and Ariane from Color and send us your questions also from MHOA, MEPHN. And I just want to thank the collaboration with MHOA and for all the nurses out there that are on this call as well. Brittany, thank you. Ariane, thank you. Ray?
Oh, sure.
Say any last words?
I just wanted, again, thank you so much, Brittany and Ariane, for being here today. We really appreciate the updates and the presentation. Again, this will be recorded if any of you need to go back. We'll put that up on the website. We want to thank our staff at MHOA for helping put this together. And thank you to Gail at Massachusetts Public Health Nursing Association. Just a couple quick things. The evaluation link will be emailed to you later today. Again, the slides and recording will take a few days to get up. And we will make sure we get answers to your questions and send that out. Okay. Thank you so much, everyone, for being here today. We hope you have a great afternoon.
Thank you.
Thank you to Brittany and Ariane. Thank you.
Thank you.